Welcome back to my channel. Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about the teaching styles. Let's get started. A nursing teacher is a nurse who teaches students how to take good care of patients. They explain lessons in class, show practical skills in hospitals, and guide students to become kind, confident, and capable nurses. In this video, we are going to talk about the different teaching styles used by teachers to make learning effective and enjoyable. First, we will discuss about the formal authority style, also known as the expert or lecture style. In this teaching style, the teacher is the main source of knowledge and has full control over the classroom. The focus is on delivering correct information, maintaining discipline, and ensuring students understand theoretical concepts. It is a teacher-centered approach where students mostly listen, take notes, and learn through lectures, PowerPoints, and structured lessons. End. Period. And main characteristics are, it is a teacher-centered approach, meaning the teacher does most of the talking and explaining while students listen and take notes. The focus is on theoretical knowledge and accuracy, helping students understand important facts and concepts correctly. There is limited student participation, as the teacher leads the session and students mainly observe and absorb information. This style usually includes lectures, PowerPoint presentations, and structured notes, making the lesson clear, organized, and easy to follow. In the formal authority style, the teacher plays the role of a subject expert who has strong knowledge of the topic being taught. The teacher sets clear objectives, rules, and expectations for the students to ensure a disciplined and focused learning environment. They guide the class by delivering structured lessons and make sure students understand key concepts correctly. The teacher also evaluates students through tests and written exams, checking how well they have understood and remembered the lessons taught. This teaching style has several benefits. It helps the teacher cover a large amount of content efficiently, making it useful for subjects that require detailed theoretical knowledge. Because the teacher maintains control of the classroom, it helps to maintain order, discipline, and focus among students. This method ensures that lessons stay organized and that all important topics are properly explained within the given time. Although the formal authority style is very effective for teaching practical skills, it also has some limitations. Sometimes, students may become too dependent on the teacher, waiting for guidance instead of thinking and solving problems on their own. This can lead to passive learning, where students simply copy what the teacher shows, rather than exploring or understanding the reasons behind each step. Because the focus is mainly on imitation and accuracy, there is less opportunity for developing critical thinking or creativity, as students may concentrate more on performing tasks correctly than on understanding the deeper concepts or making independent decisions. In nursing education, this style can be seen when a teacher explains anatomy and physiology through lectures, using charts, diagrams, and PowerPoint slides. Students learn by listening, observing visuals, and taking notes, rather than performing hands-on activities or group discussions. Next, we will discuss the demonstrator style, also known as the coach or model style. In this teaching style, the teacher shows how to do something, and students learn by watching and then practicing it themselves. It is commonly used in clinical and skill-based nursing education, where learning practical skills is very important. The characteristics of this style are that it is teacher-centered but includes active student participation through hands-on practice. The teacher first demonstrates the correct procedure or technique, and then students perform it under supervision, which is called a return demonstration. It also makes use of audiovisual aids, such as videos, charts, and models to make the learning experience more effective and engaging. The main focus of this style is on skill mastery and competency, helping students become confident and accurate in performing real nursing procedures. In the demonstrator style, the role of the teacher is to demonstrate procedures step by step, showing students exactly how a task should be done. The teacher carefully explains each part of the process, making it easy for students to follow. After the demonstration, students practice the same procedure while the teacher supervises and corrects their performance, ensuring they develop the correct technique and confidence. The advantages of this style are that it is ideal for psychomotor learning, where students need to develop hands-on skills, such as performing nursing procedures or using medical equipment. It also enhances understanding through visual and practical experience, allowing students to see how things are done and then apply what they have learned in real or simulated settings. This method builds both confidence and competence in nursing practice. The demonstrator style also has a few limitations. It can be time-consuming, as each procedure needs to be shown carefully by the teacher and then practiced by every student under supervision. This may limit the number of skills that can be covered within a given time. There is also limited opportunity for individual creativity, since students are expected to follow specific steps exactly as demonstrated, leaving little room for personal approaches or innovative methods. Example in nursing. This style is often used when a teacher demonstrates an intramuscular injection technique, explaining each step clearly and safely. After watching the demonstration, students perform the procedure under the teacher's supervision, allowing them to practice and improve their skills with proper guidance. Next, we will discuss the facilitator style, also known as the guide or student-centered style. In this teaching style, the teacher acts as a facilitator of learning, helping students explore ideas, think critically, and apply concepts on their own. Instead of simply giving information, the teacher guides students to discover knowledge through interaction and reflection. The characteristics of this style are that it is student-centered, giving students an active role in the learning process. It encourages discussion, problem-solving, and self-learning, allowing students to think deeply and share their ideas. The focus is on reasoning and understanding rather than just memorizing facts. The role of the teacher is to create an open and interactive learning environment where students feel free to ask questions, express opinions, and reflect on what they learn. The teacher uses engaging methods, such as group discussions, case studies, role plays, and simulations to make learning more meaningful and practical. The advantages of this style are that it promotes active learning and critical thinking, helping students become more confident and independent learners. It also improves communication and decision-making skills, which are very important in nursing practice. However, there are some limitations. This style requires more time and high student motivation, as learners must actively participate and take responsibility for their own learning. It can also be challenging to manage in large groups, where not all students may get equal opportunities to engage. Explanation. In nursing, this style is often seen when a teacher facilitates a case study discussion on managing a patient with diabetes. The teacher guides the students to analyze the situation, discuss possible care plans, and decide on the best nursing interventions, helping them connect theory with real-life practice. Next, we will discuss the delegator style, also known as the supervisor or consultant style. In this teaching style, the teacher assigns responsibility to students and encourages them to take ownership of their own learning. It is often used in advanced levels of nursing education, where students already have a strong knowledge base and need to develop independence and leadership skills. The characteristics of this style are that it is learner-centered and promotes autonomy. The teacher takes on the role of a consultant or observer, stepping back to let students make decisions, plan activities, and solve problems on their own. The focus is on self-directed learning and teamwork, where students collaborate and learn through experience. The role of the teacher is to provide resources and guidance when needed, while allowing students the freedom to explore and apply their knowledge independently. The teacher monitors progress and offers feedback, helping students stay on track and reflect on their performance. The advantages of this style are that it builds confidence, independence, and leadership skills in students. It prepares them for real-world professional roles where they must make decisions, manage responsibilities, and work effectively as part of a healthcare team. However, there are some limitations. This method may not suit beginners or less motivated learners, as it requires students to take initiative and manage their own learning. It works best with mature and responsible students who can handle independence and accountability. Example in nursing. This style is often used when students conduct a health education program in a community, taking charge of planning, organizing, and presenting. The teacher observes and evaluates their work, offering guidance only when necessary, allowing students to learn through real-life experience. Here's a simple summary of all 4 teaching styles. The formal authority style, expert or lecture style, is a teacher-centered approach where the teacher is the main source of knowledge. Lessons focus on accurate information and theory, usually taught through lectures, PowerPoints, and notes. It ensures discipline and content coverage, but may limit creativity and student participation. The demonstrator style, coach or model style, combines teaching and doing. The teacher shows how to perform a task, and students learn by watching and practicing. It is widely used in clinical nursing education for developing skills. This method builds competence but can be time-consuming and limits creativity. The facilitator style, guide or student-centered style, focuses on active learning. The teacher encourages discussion, problem-solving, and self-learning, helping students think critically and apply knowledge. It promotes understanding and communication, but needs more time and student motivation. The delegator style, supervisor or consultant style, gives responsibility to students, allowing them to learn independently. The teacher acts as a guide and observer, providing feedback when needed. It helps students build confidence, leadership, and independence, but it may not suit beginners or less motivated learners. That brings us to the end of today's session on teaching styles. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.